my first question is, what were your intentions going into your ketamine sessions?
Um, the first time I started, I was for suicidal ideation. The first time I tried to kill myself, I was like 8. And when I started ketamine, I was like, basically, you guys have 3 days. Um, I'm done playing around and I'm not doing another 16 weeks of med changes. I've been on meds for 25 years and I've been on everything and it's not helping anymore and I'm not playing for another 16 weeks. And ketamine was the only thing that they were like, hey, maybe you'll feel better soon. And that's literally never been offered to me before, to feel better soon. So I figured we don't really know what's going to happen in the long term, but we know what the short term effects will be if I don't do it.
Okay. Well, I think that answers the second question as well. Um, so, did your therapist help you with um, intentions going in before the session? And you were doing, uh, or how would you say, therapeutic dose?
Yeah, so she's done both the nasal spray and the like the trip dose,
Yeah,
psychedelic.
I've done infusions, I've done intermuscular, I've done nasal sprays at home, and I've done nasal spray assisted therapy. And then I have 2 therapists outside of Dr. Goldman, and then she's my psychiatrist, and then sometimes I also do therapy with her. But I don't do ketamine assisted therapy with my trauma therapists.
Okay.
And
So,
they're really uncomfortable with like suicidality and like they freak out a lot more. Where Dr. Goldman's just like, yeah, okay, that's what you're dealing with and what you've done your whole life because this is your brain.
So for the purpose of this discussion, because I would say actually that she's done ketamine sessions on various different goals, but for purposes of what since she raised the first time and suicidal ideation, um, then so Jacob's question specific to that would be, did your therapist, which in this case was myself, help you with your intention going into the session and how?
It was to not kill myself right then in the beginning.
Mm-hmm.
And sometimes that's what I use them for, and sometimes it's to make my moods better, and like sometimes it's to get me out of crisis, and sometimes it's for like trauma therapy, and sometimes it's just to access feelings because of, I guess, childhood trauma or autism or whatever. I can't access crying.
Yeah.
Like, I don't really cry
yeah.
unless I'm on ketamine.
That's true.
So were you anxious before starting the process, or did you know anything about what being on ketamine would be like, and how did you feel about it going into it for the first time?
Um, I was, I wouldn't say anxious because I was so depressed the first time that I literally didn't care what happened to me. Um, I like to read everything before I do anything. Like that's how I figure out my place in the world. So I read the MAPS guide, the ketamine papers, and that helps some. Um, but mostly I was just like, I don't really believe in this, but I also don't care. Like, what's the worst thing that can happen? if I die, I die. And I'm already looking forward to that anyways. I didn't really think it would do anything, but I didn't have anything to lose. And that was enough for me. I didn't go in thinking it was going to be some saving grace, but I trust my team enough to know that they make better choices for me when I'm really sick than I do. So I might as well trust them.
So during your experiences with ketamine, were there any moments that you felt help you gain clarity on, or help you better deal with your suicidal ideation and with your other key issues that you had going into these sessions? Did you feel like any of them gave you a sense of clarity on how to deal with those issues?
Yes, but they vary a lot. So, for the infusions, especially when we're still like earlier on, so I guess in like most of 2019 and the earlier part of that, when we were still messing around with dosages. Also, it's really hard to dose me because I have some other health stuff that makes dosing me with I can't think of the word. What is it that anesthesia?
Oh, I was going to help out, but I wasn't sure where you were going.
Yeah, that makes anesthesia, like I can fight anesthesia in absurd amounts. So like I'm 5'1", but I can use anesthesia for like a giant man. So trying to find the right amount is kind of crazy, especially depending on how activated I am. So sometimes you can give me like however much and literally nothing will happen. But then other times I can take less than that and I'm like in a crazy K-hole. So sometimes this will sound like, I mean, I guess I don't really care how it sounds, but a few times I would have these trips where everything, like, I would understand that everything was really meaningless and nothing was actually connected at all. And if I did kill myself, that was completely fine and I wasn't hurting anyone. And that actually was really calming for me. And took a lot of the pressure off of me. And both of my, I don't really know how personal I'm allowed to get in this. Both of my parents died when I was young. And it made that seem a lot less like about me and just luck of the draw. So it made everything seem less connected and less personal. And even when I was coming out of it, I was like, oh, that would be really upsetting to other people that nothing's connected and nothing has purpose. But to me, that was actually really helpful. Sometimes I have trips, like I usually remember like bits and pieces. I always have auditory hallucinations, always. And I remember those. Um, I cry, which is like not a thing that ever happens to me. I don't cry as a person. Um, I'm not even like when I want to cry, I can't cry. But when I take ketamine, I just apparently cry all the time. I can. I usually think about my parents, which I can't often do. It usually like my brain just cuts me off and just like dissociates. A lot of the things that I want to deal with in therapy, I can't do because I dissociate without choice, and then ketamine makes it so I don't do that. And I feel like I get to heal a lot because I can think about the things I need to think about without going away. And been in therapy. I'm 33, so I've been in therapy for 23 years, and I've gotten more done in like 3 years than I have in the previous 20. Um,
Do you think that's partly because of the ketamine? Is that what you're
I
saying?
think it's the ketamine. I think it's having the right therapists.
Oh.
Um, but I think it's the ability to cry,
Mm-hmm. To
and
feel.
whether it's autism or trauma or OCD and just instantly dissociating, it just never happened.
Mm-hmm.
And ketamine lets it happen in big parts. It's like a year of therapy, but like in an hour and a half. And then I don't
So would
remember it for a couple of days, but then I remember it later. And that sucks. It sucks to be sad. It super sucks. But then I heal some. So it's important, but like, yeah,
so would you
man.
say that a lot of these insights that you have while you're on it, are they usually fairly tangible? Like you were talking about the feeling of everything not really being disconnected, or do you feel like you usually come out of it with something that you can process with Dr. Goldman? And how does that usually go? Like with the situation uh, with having that feeling of everything being disconnected. Um, did you process that with Dr. Goldman, or was that just something that you really felt in that moment and was just inherently healing to you?
Um, well, for the first couple of days, nothing really registers. It's all just floaty in my brain. Um, and then it kind of just like straightens itself out to me without really talking about it. Um, and then the next week when I go in, I can be like, I can kind of put it into words. Um, and like everything being disconnected and stuff, I couldn't really explain, but I could explain the fact that like this feels less my fault, and like maybe I'm not inherently bad in the reason that all of the people that took care of me died. Like, so I could express those things, but I couldn't, like, I still can't explain what I saw or felt when I was like, in some other universe, high as a kite, and like the images that I saw. Because it doesn't make sense. I could just be like, I felt like sand, but there was music, but like, that doesn't make sense to anyone. But like, I know what I saw. And also I know that I was really high and on drugs. But like at the end of the day, does it matter that I was really high and on drugs and felt like sand if, 14 months later, I can realize that I didn't cause cancer and disease as a child? Like, that doesn't really matter. And like, I knew those things intellectually, but childhood trauma doesn't care what you know. Um, and then with the nasal sprays, the ones at home would keep me out of crisis. And then the nasal spray assisted therapy helped me, like, if I'm in therapy and we're talking about big stuff, the second I get triggered, I just stop. And nothing anyone says matters. But with the ketamine, I can not get so triggered and not have such, like, I know I still have PTSD and CPTSD, but like I don't have to give in to those reactions with it. And so I can actually do the therapy and hear what the therapists are saying. And like, I mean, I can still be a complete jerk and just be like, no, you're wrong, and I'm not listening to you, and I hate everything you're saying, and I'm done now. But like, it's not so much a gut reaction, and I don't spiral the same. Yeah, I don't know. It's crazy. It's kind of like EMDR, but really, really, really focused in this ball. And it makes more sense than being like, we don't know why it works, but Marshall Lanahan says it does, so we just do it.
So do you feel that any of the really powerful sessions that you've had, where you feel like you've really tapped into something about your past or about the issues that you were dealing with, do you feel like those sessions have changed the way that you see the world and the way that you behave in your day-to-day? And how much do you attribute that to the sessions, and how much do you attribute that to the work that you've done with Dr. Goldman?
I'm alive because of ketamine. I can pinpoint on a calendar 3 times that I would be dead 100%, because if I didn't have ketamine, there wouldn't have been another option. And I think that is ketamine and Dr. Goldman. Before I saw Dr. Goldman, I was seeing a psychiatrist that I saw since I was 8. I started seeing Dr. Goldman when I was like 29. I saw that psychiatrist because I had seen him longer than I had had any parent in my life, including my birth parents or my adopted dad. And I wasn't really comfortable changing that because I didn't know any other adults that long. But I live in a different state, and I needed to see someone when I would have crisis that wasn't like 5 hours away, and also someone that treated me like an adult. And I got a whole new set of diagnoses and got to say no to meds and got to, it's just a whole different experience. my diagnoses were explained to me, and it was like a whole different world. And I felt a lot less broken. And having ketamine and seeing it work and like understanding not just ketamine but also the other meds and like learning the science behind them and then seeing them work makes me feel so much less broken. Because I don't just feel like it's like a character flaw or a lack of trying. It's like, okay, here's this thing. Or even with childhood trauma, like that's also my job. That's what I do. And I understand it and work through it with other kids. But like when it's yourself, you can't see it and apply it. But with the ketamine, I'm able to be like, I always say it gives me like that 30-second pause because I'm able to have a feeling that's not stuck in trauma with the ketamine. And so I'm like, oh, I can think something else. And then I can realize that it is just trauma and it's not who I am. And that gives me such hope because I can be like, I'm just trying to think of an example. Like, okay, if someone gets sick, like, okay, with COVID. So, like, obviously, I know people that are sick or have died, and I'm not instantly like, it's because I love them or because they love me. It can be like, it's because there's a pandemic and America sucks at handling it. And, like, we're not doing anything right. And if it was 4 years ago, I would have been like, it's because I was dumb and got close to them and I love them or let them love me, and therefore that's why they died. Because I've had these trips and I've had this ketamine assisted therapy where someone can say those things to me and I'm not instantly like, no, you're dumb, you don't understand, you're just lying to me. I have this medicine in me where I'm like, oh, maybe this person that's way smarter than me knows something. I'm able to be like, oh, okay. And so I just feel sad and I feel lost, but I don't feel that fault. And that's a whole new experience for me. And it's crazy and it sucks, but it sucks differently. But yeah, we talk a lot about how I wouldn't have been able to exist through COVID if it was 2 years ago. Never would have made it.
Well,
it's really awesome hearing that you had that shift within yourself. You wanted to say something? Sorry.
I was just going to. I don't want to get you off your interview plan too much, but part of her diagnostic kind of picture is the obsessive compulsive piece is like and a sensation or awareness or feeling that you're causing bad things happening to other people. So it's like an existential sense of responsibility that other people may not have.
Yeah, but also there's nothing I can do to make it not happen.
Right. Like
I don't get to like wash my hands or count things. I just am screwed either way.
By your very existence, you are causing bad things to happen to other people, right? So whereas a lack of connectedness, and it sounds like a negative to a lot of people. In this case, I'm trying not to use your name, so I'm saying in her case, it doesn't sound so personal, but it's a accurate statement because it's a healthy liberation from that responsibility to be the cause of other people's pain and suffering.
Yeah.
And then I would also just add that I don't think that the insights that came out of the ketamine work were necessarily things I was feeding all the time. It Yeah, I think a lot of that spontaneously came from you
Hmm.
when you were in. So I wanted to put that out there because it's
I would
not.
say I came up with most of it myself, and then you read back to me what I say when I'm sober.
Yeah. So
Um,
I think that's true.
and then I had one session recently, where my adopted dad came with me for ketamine, and I've never had that happen before, and it was a completely different experience where I never feel safe ever. I feel safe with my dad or my wife, and that's it. My dad came, and I had a lower dose of ketamine. But apparently I screamed, I cried, I saw my mom. I was very wild, very upset. Um, and I don't remember a lot of that, but I was exhausted for a week. Um, oh, and then I don't really know how this fits into this interview, but I have chronic pain, severe chronic pain, and the ketamine doesn't really help my pain like we expected it to. But that's not really
Mhm.
psychological. That's just an unfortunate tidbit.
Mhm. Yeah.
Well, I think that all this goes really well into um, the last question, which is I'm going to break it down into a couple of parts just because there's a lot going on there. But the last question has to do with a questionnaire called the Mystical Experience Questionnaire. So I wanted to ask you about some of the different uh, parts of it and whether any of them resonate with you or whether you feel like whether you feel like any of these items relate to any of your sessions that you've had with ketamine.
Okay.
So the first one um, is an item, sacredness, a sense that what is encountered is holy or sacred.
Um, I definitely feel like it's the most real thing I've ever experienced. I have a complicated relationship with religion. Um, but it's definitely felt the least influenced by others' beliefs. Um, so to me, I guess so. It's what I think is like true and real, and not complicated by others' opinions of what I should be experiencing.
Okay. The next one is noetic quality, and the description for that is the experience. The experience is imbued with an aspect of meaning and a sense of encountering ultimate reality that is more real than usual everyday reality.
Yeah, definitely.
Basically what you just said, yeah.
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 So that really goes with what we're talking about.
Uh-huh. Uh,
Um, if you want to expand on that more, I can
the
wait
only
for it.
thing is the auditory hallucinations that I have, usually when I'm going in or coming out, those are always really heavily influenced by whatever like TV I've been watching. So like when I was,
Interesting.
what do you say?
I said, welcome to trippy experiences.
Yeah, so like when I was watching a lot of like Adventure Time, that was happening. But then when I was watching like a lot of Homeland, it was like really scary. Um, but when I'm like actually tripping, it's totally real. It's just the auditory part that's influenced.
Very interesting. Okay, so the next item is deeply felt positive mood. And this is also something that you talked about already. So the description is joy, ecstasy, blessedness, peace, tenderness, gentleness, tranquility and awe. So just deeply felt positive mood.
I don't know that I would say that. I'm not a person that really has a lot of joy. I really appreciate just when I feel connected to something, or just the lack of, like, whenever I feel a lack of fear or a lack of pain, I really try and stop and just appreciate that. Um, but I don't know that there's ever been just like joy in ketamine time. Um, Sometimes there's moments where I'm just the the absolute pain of having to exist stops, and it just doesn't matter if I'm alive or not, and that's enough for me. It's not that I need to be happy to be here. I just need the pain of existing to stop, and that's it. And I'm fine with that. I don't need to be happy all the time. I just need it to, I need the movies of the horrible things that have happened to stop. Um, I need to not be afraid that someone's about to hurt me again. I need the physical pain in my body to stop. But I don't need joy constantly. I can make my own joy. And with ketamine, I do get those times of just nothing's good, nothing's bad. And that's totally enough for me.
Okay, so the next item is ineffability. And this is, the description for that is the experience is difficult to put into words.
Yeah. Yeah, I definitely find myself coming out of it just being like, oh, I curse a lot. And Mr. Dr. Goldman's always like, oh, okay. He apologized to my dad a lot for my cursing, and my dad was like, I met her when she was 13. This is fine. Yeah, there's not a lot of words. There's a lot of colors, but there's not a lot of words.
You find it hard to describe that place that you go? Like if someone asks you to describe it, yeah. It's hard.
Yeah.
I have to say something.
Okay.
This is off script,
Okay.
but you're not the only person that has said that they feel sandy, by the way. But it's funny
Yeah.
you say
It's
that. I've had other people say sandy.
Yeah. I feel sandy. It's so weird.
So anyway.
Interesting. Like the feeling that you're in sand, or is it like?
No, that my body is like, have you ever played with kinetic sand?
Yeah.
I feel like my body is like made of kinetic sand, and I'm like moving through dimensions in as sand.
Yeah.
Like I am not a human anymore. I'm like moving as sand into like different experiences. It's
So you are the sand.
I am the sand. It's nuts.
Okay, so also if you want to expand on anything more so, just like need some time to gather thoughts or whatever, you can stop me and let me know.
Okay.
Okay, so the next.
They always said you'd get like this out of body thing. Like my friends that have taken it for fun. I've never taken chemical drugs for fun. I've only ever done things from the ground. I'm a hippie, I don't know. But like that out of body looking down thing, I never got that. That's it.
All right, so the next item is paradoxality. Paradoxicality, excuse me. And the description for that is, to explain the experience, one seems to have to describe the coexistence of mutually exclusive states or concepts. So I guess just in, more understandable terms, just feelings of things that you're experiencing or feeling being paradoxical to each other.
Yeah, I mean, it's like I remember what is real life, but I also feel like that doesn't exist, and I'm in this other world of only I exist, and like it's constantly that I'm moving through like these different forms, and like it's this predictable pattern. And I don't know if that's just me because I live for like patterns and shapes and textures. And like I know that nothing is alive and nothing is dead, and I'm just like moving through it. Um, and it's almost as if I could fight to get back to the real world, but like I don't want to. I hate the real world. Why would I want to be here? And I'm just like, okay, I'll just do this. And then eventually I start to sober up and I'm like, oh, damn it, I have to come back. I mean, it's just that, it's just that feeling of like, it's, it's really real, but like, and I don't know if it's because I can fight the drugs so much. Like, I can, like, Dr. Goldman's commented before about how I'll chew gum through the whole thing. If I have my watch on, I'll like, if they don't take my phone and my watch away from me, I'll answer texts through ketamine. Like, I can fight the drugs ridiculously. So I know it's not real, but I want it to be real. And so I'm sand, but I know it's not real, but I want it to be real, so I'm trying to give in. And I mean, to say it's like a mind trip is obviously the dumbest thing you could say, but yeah, it's a mess.
Trippy. It's trippy.
It's trippy.
Well, I guess that leads us into the last item for the mystical experience questionnaire, which is transcendence of time and space. And then I can read the description, which is: introvertive mystical experiences have a non-spatial and non-temporal aspect, such that the traditional notions of time and space have no meaning.
Yeah. So I will come out of it. I'm always trying to look at my watch because that is a huge control thing for me. Um, Control is a big issue for me. Um, I constantly am fighting everything. Um, Needing to know what time it is. When they take my watch, I'm always asking what time it is. But I'm better about that now. And especially now that I know Mr. Dr. Goldman pretty well, I can just let it be. Um, but like, because it will feel like days. And then he'll be like, it's been an hour and 15 minutes. And I'm like, absolutely not. That's shut up. Because it feels like days. And sometimes I'm like, I'm 100 years from now and like either direction. But I always come back and I'm looking at the same poster of trees on the wall. And I'm like, how is this possible? And a lot of times, because I went to Warren Wilson, so like a lot of my drug experiences are taking mushrooms out, by the white barn. And so I'm always like, oh, I know where I am because I'm out at the white barn, or I'm down with the piglets, or I'm on the river trail. And so, like, even when I'm coming to, I think I know where I am because I'm at my house, like, I'm in my home, I'm at Warren Wilson, and like, so I'm like looking around to like get my bearings and where I lived for 5 years. And then I'm like, no, like, these are not the walls I know. Like, this is not my dorm. This is not Schaefer. This is not Dorland. Like, what's happening? And they freak out. Um, and that's only with like the infusions. With the nasal sprays, I never lose my place. Although when I look out the windows on the nasal spray that Mr. Dr. Goldman makes, it's weird. It does something weird to my eyes. Um, but yeah, like, it is always days to me. And like I don't time travel, but like I time travel. Um, and I don't love that aspect because I am very much a controlled person that checks my phone and my watch probably every 3 minutes. I need to always be looking at the door or have my back to the wall so I know who is near me, who can come near me, like what's going on. Um, and obviously, when you are high as a kite and not living in a real world where there are doors, that's not so much a thing. Um, and even like when they take my vitals and stuff, I don't usually notice. And like honestly, that really freaks me out because someone's touching me and I don't know. And that's kind of like, I mean, it's fine because I trust them both so much, but like I would never go anywhere else for ketamine because someone could just touch me. If I didn't have like my dad or my wife or my best friend there, like someone could just be touching me and I wouldn't know. And it's terrifying.
I've seen
Uh,
go back in time also, like go backwards in time, and you'll find yourself, at a house of a friend or a house you used to live in, and sort of,
yeah, and I remember houses like step by step.
yeah, you'll
Really
describe to
weird.
me, you'll describe to me really clearly where you are, like as if you're looking around the room and you're really very much there, and you're able to,
I
move through the environment there. And
I can remember what's where in a pantry in someone else's house from like 25 years ago. Um, and yeah, even houses that don't exist anymore.
yeah, it is like,
Um,
I would say in your case there is like a time travel piece that you sometimes do. Yeah, it's kind of overt, like you zoom
and
back.
it's weird because like I don't think in pictures. I don't know, autism brain. Like I think in photographs. Like I don't think in moving pictures at all unless they're like trauma memories.
Mhm.
But when I'm on ketamine, I think in like full Technicolor movies all the time. And it's really overwhelming. Like if that's how I thought all the time, I would never get anything done.
Mhm.
It takes everything out of you. It's like, I mean, it's like living two lives, man. It's crazy. It's being alive while you're sitting in this chair and you can't do anything.
So it sounds like you both you have that time travel feeling, and you also have that, you said earlier, that like interdimensional, moving between dimensions, like
It
space travel.
depends on, you know how like with the IVs, like it goes into waves of how much you're getting at that second.
Yeah.
When it's the big waves,
Hmm.
that's when I'm sand. And when it's the like lower waves, that's where it's just like super really vivid dreams.
Noted.
So when you're going to these houses, are
Yeah.
you like, do you usually feel like you're there in your own body, or do you usually feel like you're in that like sandy amorphous space moving through these different uh, places in time?
They're usually it's usually like I'm watching something that's already happened. So it's me, but it's like, so I'm watching as me now, but I can see me then as like a kid. And usually what happens is I'm watching something that I need to deal with. So like I've watched like at my best friend's house from when I was little, I've watched me get ready for my dad's funeral. Um or um I've watched one of my dad's nurses abuse me. Like I've seen stuff like that. Um but then I can't handle that, so I just walk away and walk through the house. Um
So the ketamine brings you to those times and places, but you're able to engage it or like choose to move away from it a bit if you need to or
yeah,
prefer.
I usually walk away, but then like over the next week I'll remember those things.
Mm-hmm.
And I guess that's what I'm, because I don't remember crying when I'm on ketamine. I just, you tell me that I cry and I wake up and I'm so tired and my face hurts and my face is wet and I'm like, what's happening? And you were like, yeah, you're sobbing. And I was like, oh no, I don't cry.
Right.
Um, and then like over the next week, it's like everything kind of comes together
Mhm.
and I'll be like, oh, this thing. And you're like, yeah, you mentioned someone named Barbara. And I'll be like, oh, fuck Barbara. She hurt me. And you're like, okay, you want to talk about that?
Right.
Um, and so it's stuff like that
Mm-hmm.
where I'm like, oh, I don't talk about that and I don't think about that. And you're like, well, you obviously need to. And I'm just like, oh, okay.
Mm-hmm.
But like, I won't have thought about it for 15 years or something because that just gets put in this part of my brain where we don't do things.
Yeah, it's interesting because we don't often have this conversation either, right? Like
Right.
this is like a meta conversation about treatment, but not in treatment, right? But sometimes you will have an experience like that, something from the past, and you will say something while under the ketamine, like, I should probably talk about, or I don't like to talk about this, but it's a big thing, or like you'll sort of announce to me that you need to talk about it, some statement like that, and you don't always remember later that you said that.
Yeah, I often give myself away and then I get really mad when I sober up.
Yeah, I think that's probably true. Like your barriers are down some, so you're, yeah, more than they are when you're sober. So and so sometimes, I don't know, Jacob, just to explain what we're talking about. Sometimes what I'm doing is just kind of reprompting Jill about the stuff that she already said she wanted to talk about, but she may not remember exactly what she said or didn't say to me about it. So I may just say, well, here's what came up and here's what you brought up last time. Does that resonate? Should we go there or
Oh,
not go there? It's pretty
right. I
much.
remember I was like, I remember being like, oh, that was something with Leslie. And I was like, oh, that's a whole thing we should probably talk about.
Mm-hmm.
And then the next day when I saw you, you were like, "So you said about with Leslie's mom," and I was like, "Oh no, I didn't say that." And you were like, "Yeah, you did. I wrote it down." And I was like, "Oh, I'm not talking about that." And you were like, "That's up to you, but you said it was important." And I was like, "Well, we'll deal with that in a couple of years." Like, I'm
Right.
just not doing that
We don't
now.
always go there. That's true because it's up to you when you are sober to decide where you want to go. Not
Right.
right. That's
But
what.
things that I won't even
Yeah.
like, I'm completely not cognizant of when I'm sober. Like, they're so buried. And then with ketamine, they're just right there.
Hmm. Yeah.
So you were talking about how uh, you go to some of these places that you feel like you haven't been to in like 15 years or a very long time. How does that feel when you go back to these spaces uh, when you're in one of these sessions? Do you feel like you recognize it right off the bat, or do you feel like you're usually trying to like put different pieces together while you're in there?
No, I know what they are right away. Um, that's just the thing that like my brain does, and I don't know if it's just like a me thing or an autism thing, but like I can remember houses and spaces way better than faces or people. Um, I can remember that test really well. Um, I just don't really think about them. But I think because I've always been so hyper vigilant of being hurt and who's around me that any place that I spent much time as a kid, I still remember everything about those spaces and like where I felt safest and like where the doors were and that kind of thing.
Hmm.
So it's not super surprising to me. It just seems kind of like a waste of brain space though. Kind of like how you always remember like your second grade teacher's phone number or something useless. It's just like I have like all of that information stored, but it's everyone's houses that I went to elementary school with or something. It's just one of those annoying things where like I really could use that space for anything else. Um, but I don't, so I'm not surprised it's there, but then like I'm really surprised that during the deepest of therapies, that's what comes up.
I have one last question I like to ask everybody. Um, but Jacob, do you want to circle back to anything, or do you have what you need?
No, I have everything that I need. Thank you so much for answering all my questions and taking the time
Yeah.
to yeah, entertain these questions.
No problem.
Um,
Yeah,
yeah.
we both appreciate it. The last one I have is what advice you would have for someone else that was thinking about doing this kind of therapy and was, or what you would say to someone.
I mean, like for my family, the biggest hurdle, I mean, for most people, I think the biggest hurdle is cost.
Hmm.
Um, but for my family, they were really worried about what are the long-term effects.
Hmm.
And we don't know, but we do know that I would be dead within a week without it. So really, what's the harm? Like, let's say it takes 20 years off my life. That's 20 years I didn't have. If it gives me 20 years, like, it doesn't matter. And like, there are definitely negative side effects, but I'm alive. And I would say 50% of the time, that's really a good thing. Um, COVID makes it less so, but the side effects, I mean, I was alive 3 days later.
Hmm.
And there's literally never been another medicine that's going to do that.
Yeah.
And I've been in the system so long that I could get through any hold that they would ever put me under. and get out. Like, it's just not a thing. So to me, ketamine's, I mean, it's a miracle because it's the only thing that's ever, it's kind of like antibiotics. It's the only thing that's ever given me relief while I was suffering and not just been like, maybe this will help buck up.
Yeah.
And that's crazy for psych meds. That's not something that happens. I've been doing this since 1995.
Yeah, I think you're speaking to the difference between psych meds in the old sense and psychedelics as meds, which is
Well, I mean, I've been very lucky, and money's never been a barrier. And this is the first time anyone's ever offered me something that made me feel better. That wasn't. I mean, because since I was a kid, they've been like, here are tranquilizers. Here's this. Here's this. This will make you stop doing things, but nothing made you feel better.
mm-hmm.
They just drugged me into submission for 4 or 5 years at a time. I didn't feel better.
Right.
They just made me compliant and not a liability for them. But now I'm like a person, and I do things, and I have feelings. And so I'm not just a zombie. And that's, I mean, I'm 33 and I have a life for the first time.
Mm-hmm.
So that's totally different.
Yeah.
So, like, I mean, I'm not saying that you should, like, do it at parties or whatever. But, I mean, you know, my thing has always been if it comes from the ground, have fun.
Mm-hmm.
But, like, do it at the doctor's office, man. It can make a world difference. Even my dad, who's like, I don't know, seems kind of crazy. And now he's like, so do you need more ketamine or something? And I'm like, no, man, I'm just having a bad day. Don't need ketamine every time that, like, I'm upset. So
You
it's
don't.
pretty crazy.
Well, anything else that you want to say or add or that you think would be interesting or useful to have out there before we let you go?
Next, they need to make it so you can microdose mushrooms. Then I can get off even more psych meds.
Put a plug in for the mushrooms. Yeah.
Yes, I can get off more psych meds then. No problems.
Well, Jill, very, very much.
No problem. I'll see you next week.
And yeah, I've stopped recording.